I want to thank you all for continuing to tune in. We've been at this for months, our time together at 1 o'clock in the afternoon, and thank you. Thank you for staying informed, thank you for following the rules, and thank you for tuning in to these press conferences. I'm going to be back here again on Friday at 1 o'clock, this Friday at 1 o'clock, and then starting next week, we're going to try to limit this to just Wednesdays at 1 o'clock. I have a feeling there'll be enough news that we may have to do it more than once a week, but the plan going forward is once a week, Wednesday, 1 o'clock, starting next week. As we move along, obviously people are busier, not home as much, going to work. That's all excellent. I would ask you to stay informed, so if you can't tune in, consider getting the daily email updates from my office. You can sign yourself up for a daily email at governor.ri.gov, and we'll send you an email every day, and then a roundup email on Saturdays, governor.ri.gov. Okay, we begin, as we always do, looking at the data, and I'd ask that you please put the data up on the screen. And as you can see, I hope you look at this and breathe a bit of a sigh of relief. I know there's a lot of anxiety as people stay home and watch the national news of what's happening around the country, but I want you to stay focused on what's happening here. And if you look at the data, we continue to trend in the right direction. Rhode Island's test positive rate is low, hospitalizations rate is declining, and you'll see today we're reporting 41 cases, which is a good trend, and very sadly another 2 deaths. It is, every time I read that we have another number of deaths, it's a reminder to me that we are not out of the woods, and every single day Rhode Islanders die from this virus. So that ought to be a reminder, a stark and harsh reminder to every one of us that people die if we don't follow the rules. And the people who are dying are loved ones, mothers, fathers, husbands, sons, daughters, grandmothers. So it's on us to do everything we can to protect Rhode Islanders. I will say the toll that this virus has taken on our state far surpasses the number of people who have died or been in the hospital or been sick with the disease. We've been at this now for 4 months. Seems like a lifetime. It's been 4 months. And in that time, our lives have really changed. And I want to take a minute to recognize the real suffering, anxiety, insecurity, depression, financial insecurity that people are struggling with. There's not a person in Rhode Island who isn't struggling in some way because of the virus. And I want every one of us to know that some folks, those who came into this crisis poor, vulnerable, sick, lack of access to health care, food insecure, these are the folks who are really struggling. So as we begin to get back to life as normal, I'd ask you to remember how tough so many Rhode Islanders still have it. And remember this, in the blink of an eye, we could be back to where we were a couple months ago, struggling and surging up the curve. And yet there's no reason for that to happen. So our destiny's in our hands. And we have a shared responsibility to one another to follow the rules, be smart, so that we can continue to get people back to work and well. And just remember all the real human suffering that'll happen if we don't do that. I will say, I've said so many times, this phrase, the new normal, is one, I think we can do better than that. I think we can come out of it healthier, stronger, more equitable, better healthcare system, more resilient, more ready for the future. And next week, I plan to have a lot to say about that, around where my vision for Rhode Island, for our economy, for our healthcare system, as we come to the other side of this virus. Okay, I want to take a minute to talk about the 4th of July weekend. Obviously, it was a huge weekend. I will be honest, I went into the weekend with a lot of concern for what might happen. We had a lot on the line this weekend. There's no doubt about it. We had a lot on the line to make sure that we kept a lid on the virus, and by and large, I feel good about what we saw. The beaches were busy. It was a beautiful weekend. The beaches were busy all weekend, but we never reached capacity in our parking lots, so that was a good thing. DEM passed out thousands of masks at all the beaches, and as a result, we saw much better compliance with mask wearing. A couple of weeks ago, we had a lot of issues with mask wearing. Not this weekend, by and large. Not perfect, but there was a lot more mask wearing in the bathrooms, at pavilions, in parking lots. We gave away thousands of masks. The DEM was out in full force at the beaches, at the parks, asking folks to break up if they were congregating. And in general, people were patient and compliant. We still had some issues. People were not friendly, not patient. And I would just say, don't do that. People from DEM are just trying to do their job. They're just asking you to do the right thing, follow the law, and keep Rhode Island safe. So, don't take it out on them. They're just trying to do their job. But by and large, people were following the rules. Our business inspectors were out. We had a lot of inspectors out all weekend long. They checked in on hundreds of businesses. We focused primarily this weekend on restaurants and retail. And I would say overall, the vast majority of employees and customers were doing the right thing. This should give you confidence as a Rhode Islander. Everywhere we looked, we saw good compliance with mask wearing and excellent compliance with high-touch cleaning. More than 95% of the establishments they visited, there was excellent compliance with cleaning of high-touch surfaces. I would say businesses are making a huge effort to make hand washing and hand sanitizing options available. That was excellent. We saw that everywhere we went, well over 90% of our businesses, and so that was good. Couple of things that I need to ask you to try harder. Too many restaurants were not taking the names and numbers of the members of the party for the reservation. More than 20% of the restaurants that we visited, there wasn't a regular way for the restaurant to take down the name and phone number of somebody in the party. And that's a problem. Why is that a problem? Because if there's an outbreak at the restaurant, or if the waiter or waitress gets sick, we need to call you. We need to be able to call you and let you know that you've potentially been exposed to somebody with the virus. So it's in your own interest that we can be able to get in touch with you. This whole, our whole effort is around testing and contact tracing. One of the very best tools we have is contact tracing, tracking you down as quickly as possible to tell you you've been in close contact with somebody who tested positive. Or if you've tested positive, knowing that, so we can call all the other people who've been in touch with you. So I would say we need to do better. We need to do better at that. 20% is not okay. It's a simple thing to do. When you call and make your reservation to go out for dinner, give your name and give your phone number. Not your address, name, and phone number. It has to happen every time. Not 80% of the time, 100% of the time. It's easy, it's essential, and I'm asking everyone to do better. Also, for your contact tracing notebooks, keep it up. I'll admit, myself, sometimes I forget a day or two. I have it open on my desk, and I say, oh, you forgot. You have to go back and write it down. Please keep that up. It'll save lives. It's a simple thing. Write down who you're in contact with. And then if you haven't downloaded your Crush COVID RI app, now's a great time to do it. Lots of people are using it. I think we've gotten feedback from people who are using it that it's not invasive at all. It's a help. And if you haven't done it, I'd ask you to do it. In more than 10% of the restaurants we inspected, we observed crowding and too much mingling. So that means people weren't 6 feet apart. We have to do better. 10% is too high. So if this weekend, if you found yourself in a crowded restaurant, in a church that was crowded, in a lobby that was crowded, in line for the bathroom, too close to the next person, that's a problem. You know, just sensitize yourself to the fact that if you find yourself crowded by people, move, get out, move, get some space, go outside. That is the problem. This virus, it lives, spreads, and thrives when people are too close together, inside or outside. And I would say, if you look, you know, don't listen to me around bars. You don't have to take my word for it. Look all around this country right now. We are having, the rest of the country is having huge issues with bars being the vector of spread of this virus. No bar in the state of Rhode Island should be operating as a bar. You operate as a restaurant. There should be no congregating at bars, period. It's a pretty simple rule to follow. You're not allowed to go up, order a drink, and hang out at the bar. And in a minute, I'm going to talk about enforcement. We're going to really start to crack down on that. You can serve drinks, you can sit and have your dinner, you can have your drinks brought to you. No congregating at bars. So with all of that in mind, I want to talk for a second about how we're going to be changing our enforcement as we move forward. And I've said for many weeks, months, as I've been up here, our goal was not to be heavy-handed. Listen, I know how hard this is for restaurants. I talk to people who own restaurants almost every day, and my heart goes out to every one of you. I also admire every one of you for how creative you are. This morning I had a call with a couple dozen restaurant owners on Block Island, and it's tough. It is really hard. It's hard on your businesses, and we're asking you to do superhuman levels of creativity just to stay in business. And so I want to thank you for being so cooperative. And by the way, the vast majority of restaurants are being cooperative. And it's not our intention to be heavy-handed, because we recognize what a tough time this is for you. But I will say this, if we don't follow the rules and if we don't enforce the rules, then we're going to get into trouble, the virus is going to spread, and then we're going to have to close the restaurants again, which is the absolute last thing that we want to do. All across the country, that's what you see is happening. States that had bars and restaurants open have closed them. States that had beaches open have closed them. States that were scheduled to open restaurants decided, no, we're going to wait a few weeks. Earlier this week, Texas, California, Hawaii, Missouri, Montana, and Oklahoma set single-day records for new cases. And they're all ratcheting back the way they're opening their economy. I don't want that to be our story. I don't want to do that. The only way that I won't have to do that is if we try a little harder to comply. Now, when we began, we said we're going to have a very light touch with enforcement. But now everybody's had more than a month to know the rules, understand the rules, and figure out how to follow the rules. And while 90% of establishments are complying, it's that small percent that aren't that are going to get us into trouble. So we are going to start to change and increase the way we do enforcement. It's also a fact that when we have more of an influx of people from other states who aren't necessarily used to the rules in Rhode Island, it gets a little bit harder for us to do enforcement. People coming here from other states where mask wearing isn't mandatory, where they're a little more casual in their attitude about the virus, and so that puts a greater burden on us in Rhode Island to look out for each other and help enforce the rules. Think of it as your shared responsibility to one another, to other businesses, to the people of Rhode Island, in order to follow the rules. So going forward, the rules for businesses our enforcement will look a little different. If we see egregious disregard for the rules, like a blatant disregard, we walk into a restaurant and the place is packed, there is no effort to impose social distancing or mask wearing, people lined up, crowded at the bar, really blatant disregard for the rules, you're going to be immediately issued a compliance order, or you might be issued a fine right there on the spot. The second time it happens, you're going to be issued a fine, or you might be shut down, the business, until you demonstrate that you've made appropriate changes. I want to mention, by the end of the day today, we're going to have the updated regulations with the fines and the updated regulations and enforcement posted online at dbr.ri.gov. For less significant violations, but still important, things like lack of signage, issues with mask wearing, not egregious, honest mistakes, you're going to get a warning. You're going to get a warning. The second time around, you'll get a compliance order or a fine. And again, check out, by the end of the day, dbr.ri.gov. And you can go to the website by the end of today. We're going to attempt to clarify the rules and clarify the enforcement. You can also go to this website to register a complaint. So if you see a business isn't following the rules and you want us to check it out, go online and tell us about it. File a complaint. dbr.ri.gov. I will say we do hear all the time from people saying, I went into such and such a restaurant, it was packed, I didn't feel safe, so I left. Well, let us know about that. I want to say this. I have instructed our inspectors to work in partnership with businesses. I want to be very clear. We don't want to shut you down. I want you all open and making money. And the vast majority of you are being creative and following the rules. And if you're trying, then we're going to work with you. And we're going to help you out, we're going to give you guidance, we're going to give you a warning. But I have to tell you this, there are those of you out there, and you know who you are, you're not even trying. Your own employees, your own hosts and hostesses are whispering to your customers, don't worry about the mask. Oh, it's okay. Oh, we got this. And we're going to crack down on you. Because it's not fair. It's not fair to the rest of the restaurants if because of your noncompliance, I have to do what all these other states are doing and shut down all restaurants because of a small handful of folks that are willfully ignoring the rules. And you know what the rules are. We're not out to get you for a small infringement, a plexiglass that's in slightly the wrong place or slightly the wrong size. But we are out to get you if you are consistently, night after night, allowing large groups of people at your bars, in your restaurants, crowded for hours with no mask wearing. So I want to be clear about that. And I would say to all of you, don't let yourself be part of an outbreak. Ask, how can I be part of a solution? What's happening around this country right now is pretty scary. Hospitals filled, 90% ICU capacity filled. Houston, Phoenix, Arizona, Florida. Governors telling people to stay home. Ohio, 6 counties being, essentially shut down. There is no reason that has to be Rhode Island. Right now, Rhode Island stands out to the nation as a shining star of how well we're doing. And it's my goal to work with you to keep it that way. And a huge component of that is no crowds. So if we see you, we're not going to be afraid to fine you immediately and shut you down if we need to. I want to take a minute to talk about testing. Over the past handful of days, my office and the Department of Health have been receiving a lot of questions over the past week around travel, people coming to experience Rhode Island for the summer. As the governor of Rhode Island, I want to say welcome. We have the best beaches in America. There's no place better to spend a summer weekend than in the Ocean State, so we'd love to have you visit us and enjoy our beaches and restaurants. But we do have rules. We have rules that we expect you to follow. If you come here, we expect you to follow rules around mask wearing and hand washing and staying in your hotel or your house if you're sick. If you're traveling to Rhode Island from outside of the United States, you must quarantine here for 14 days. Nothing's changed. So if you're coming to Rhode Island from a international destination, no trips to the beach, no social gatherings, no outdoor dining, no indoor dining, 14 days quarantined. If you're traveling to Rhode Island from one of the 28 states that has a 5% or greater test positive rate, you should quarantine for 14 days. If you're here, quarantine for 14 days. That's the gold standard to keep us safe. However, we know you're here and you want a vacation, enjoy your vacation. So as an accommodation around the quarantine, we've made an exception that if you test negative, you don't have to be quarantined while you're here for your visit. You could do that in two ways. You can fulfill the exception requirement in two ways. You can get tested in your home state in the 72 hours before you travel to Rhode Island and then show us some kind of proof that you've been tested negative in your state within 72 hours, or we're happy to test you here in Rhode Island once you get here. If you get tested when you're here, you have to stay quarantined until you get the negative test. Obviously, if your test is positive, then you have to be in isolation. If you come to Rhode Island as a tourist, so you're not a Rhode Islander, you don't want to quarantine, instead you want to get tested, you will have to pay for your test out of pocket. It'll be about $100. We have set up 10 testing locations around the state, specifically where tourists can go. The list of those 10 clinics is available at health.ri.gov/COVID. So, and we're going to have signs all around the state on this. We're working with hotels and rental properties, but just so everybody knows, for tourists coming here, you should quarantine, but if you don't want to, go get tested. Go on the Department of Health website. There's one of 10 places you can get tested. You will have to pay out of pocket. It'll be about $100. You'll get your results within a couple of days, and in the time that you're waiting, you do have to quarantine. Now, I want to say this. These guidelines I've just said around self-quarantining and testing, that applies to people who are coming to Rhode Island from one of these other states that has a more than 5% positive rate, who are here, for social reasons, for here because they're on vacation. Those requirements around travel don't apply for public health workers who are coming here, a healthcare worker traveling for your job, if you're coming to Rhode Island for medical treatment, if you're coming to attend a funeral, coming to attend a memorial service, coming here to get your groceries or gas or medication, pick up your kids from camp, a work-related visit to Rhode Island. But it's primarily for tourists who are here. We want to make sure you get yourself tested so we know you're here safely. Again, we want you to come. I actually think Rhode Island's a fantastic place because we do have such a we have a lid on the virus, and we have great restaurants and great beaches. We just want you to come here, follow our rules, and be safe. Finally, I want to take a moment to briefly address visitation. I'll say one of the hardest parts of managing through this crisis are the stories that I have heard from people who haven't been able to visit their loved ones in nursing homes and in hospitals. And these are heartbreaking stories. I've heard from so many people whose husband died while he was in a nursing home and they couldn't visit to say goodbye. Parents whose kids might be at a hospital, maybe at inpatient for mental health services at Bradley, or maybe their kids in the hospital at Hasbro, and they can't go visit their kids. That is brutal. And it's been a hard decision. That has been a hard decision to hold the line on that as long as we have to keep a lid on visiting. But we've done it in light of what we thought was necessary, especially with respect to nursing homes, what we've seen happening. And also I've been hearing from, in this business I'm in, you have to really listen to all sides. I hear from the staff in the hospitals and nursing homes, and they're afraid also. They want to make sure that before we allowed visitation, they could do it safely. So having said that, we are finally at a place where we can start to ease up on the visitation rules, and I'm really pleased to be able to make some announcements today. As some of you have already reported, as of today, we're allowing nursing homes to once again accept visitors as long as there are some additional public health precautions in place. And Dr. Alexander Scott is going to talk about that in detail. Obviously, we're asking you to just be responsible. Keep your visits short. Mask wearing is essential. Pre-schedule your visits if possible. Limit the visit. Don't bring your whole family all at once. But we feel it's time for you to be able to pass time for you to be able to go and visit your loved ones in your nursing home. Today, I'm also now announcing updated guidelines for limited hospital visitation. The specifics on that are going to vary a bit hospital from hospital. Dr. Alexander Scott, in a second, is going to take us through the details of how we're going to be handling hospital visitation. But as of today, you can visit a loved one in the hospital, and you can visit a loved one in a nursing home under new guidelines. And I want you to say, I'm sorry it's taken so long, but in light of everything we faced, we felt it was the right thing to do to keep everybody safe.